Welcome to Stock Therapy with Penny Queen. Today I have CEO Dr. Issam Hamza with Treatment.com AI, and they have a new press release out partnering with Novus Health with 1.5 million members. So this is some pretty exciting news. Can you tell us a little more about it?
Yeah, no, thank you very much. This is exciting for us as well as being kind of one of our first enterprise clients. Novus Health has been around for 16 years. They're leaders in their space in health navigation, helping their clients and the clients' members with their kind of health navigation to try to make them better and back to work and healthier workers and so on with proven outcomes. And so we're really excited that we're working with Novus Health.
All right. Well, I had a look at their website and it looks like they have four core products. They have the navigation platform, which we touched on a bit here. Can you describe what that means to the average employee?
Yeah, I think the way I always look at it is that if you are an employee for a client, sorry, a company, and when you come on board, you're often given, this package, an onboarding package, and it probably has a ton of different numbers to call, if this, do this, or call this number, email these people. And it can be pretty overwhelming at the best of times. It's even more overwhelming when you are sick or stressed out or have issues with your family and you're trying to deal with all these things. You can't go to your boss, with medical issues. Maybe you can't get into your doctor, and maybe this is even a medical issue. Is it physical? Is it mental health? Is it, issues with ongoing, complex care or anything else? Where do you go? And so, it's very overwhelming a lot of times, and people tend to shut down and just start missing work, and it affects them. It affects their health, affects their family, and affects the company as well. And so, this is a way to provide kind of a one-stop shop platform to help you navigate to the right source of care to get better. And their kind of revolutionary navigation tool or platform has that ability to kind of help guide the employees to the right care.
Okay. And then, so it's employees and their families. So they have like
Right.
1.5 million members. So we can assume that with family, it's probably a lot more than that. I see they also have the risk assessment. And
Yes.
am I getting that correctly where it's evaluations for things like mental health issues or like pre-diabetes, things along that line?
I think it can be many different things. So it's questionnaires to ask about various different health risks and then guiding behavioral change. And so the great thing about our partnership is that we have, we think, one of the best AI engine, health risk assessment tools and onboarding history taking in a way that helps with getting proper history, but also help in getting kind of what the next steps are in terms of differential diagnosis and then going to the next steps and so on. So using our AI engine, I think we could probably ask better questions, more questions in the right way to get a better differential diagnosis of what might be going on, and then guiding and triaging to the right points of care. So both for the navigation platform we just talked about, as well as the risk assessment tool, I think there's some benefit there for both of those products for sure already, just using our tool that we have.
Okay, so it sounds like the end result for members is faster and now more accurate, higher quality care.
Absolutely. So I think when I talk about the benefit of what we do, because you can go, like I said before, 1,000 different ways with our product. Uh, the great thing about this partnership is they already have an established clientele with members and so on, with things that they're trying to help them with already that we can help make that better. Um, but we can also create new products with them as well that we'll talk about in a second. I think the important part is if you don't get a good history, then you don't get a good result either. And so I think it's really important that we can provide a much better history taking in a way that we actually get using our kind of our proprietary algorithm and the AI engine, a proper history taking, not only to get that differential diagnosis and the treatment options, but also to provide all that information now so that if we are connecting them to a nurse or a psychiatrist or a psychologist or a primary care doctor or a specialist, all that information now can go to them in a way that helps them a lot. It helps them so that they don't waste time onboarding you, but it helps guide them as a tool to get to the next step. You get a lot more productive benefit of when you do see the provider, that they have all that information. It's almost like having a nurse going in first and talking to you one-on-one and getting that really good, hour-long history. We can do it a lot shorter using technology when you're at the comfort of your own home.
Okay. And then I see they also have health coaching and support.
Yeah.
And then I think that kind of plays into the referrals you were just talking about. But my favorite element that they have is the second opinion. Can you talk about where your technology can be leveraged here?
For the medical second opinion?
Yeah.
So yeah, absolutely. If you think about, a complex care issue or something that is a little bit more complicated than the simple things we might have talked about earlier, where we're not really sure what's happening. The human body is very, very complex. And sometimes it's not just one issue. It could be multiple issues that could be contributing together. It might be medications that are conflicting with each other. It might be a combination of a number of different things. But unless, again, you're taking proper history with a proper kind of detailed information coming in, it's hard to triage you to the right source of help. And so if you kind of get all that information and then pass it along to the right triage, to the right provider for a second opinion, so that if you're not getting better with traditional care through the traditional system, and you're saying, look, I've been having this issue forever. I'm stuck at the dead end here with my primary care doctor or my specialist. I don't know where else to go. Can I get a second opinion? This is a way to take a proper, good history with all the information so far, and then pass it over to a specialist, the proper specialist, the right specialist, to take it to the next level of, okay, maybe we miss this issue or that issue. Going back a second here, Penny, I think this is lost a lot of times because everybody's busy all the time. But part of the reason things slip through the cracks a lot of times is that people don't spend time listening to the patient. We don't have time a lot of times listening to the patient, and the patient, I don't blame them, because they're not medically educated. They don't know how to translate what they're feeling sometimes into medical language that the physician or the nurse will understand. And so using kind of natural language and time will be able to figure out what exactly is bothering them in a way that can be going from natural language into medical language. And that's the tool that we have here. And again, in a non-rushed way of getting that translation into something where the right provider has the right information now can really help you. And that's the importance of something like this, is that it's been missing, I think. And it's something that without it, you don't get proper care at the end.
Yeah, I absolutely understand the need for coordination too.
Yeah.
I need my, life as a firefighter, seeing patients who are prescribed medications from different providers, and nobody's looking at the whole. Nobody's
Right.
seeing that there's medications. There's a lot of polypharma issues because you have medications that don't go together,
Yeah.
and nobody's really taking a look. So
Yeah, or you have family history that people didn't find out about, or you have medical diseases that have overlapping symptoms. Then it's not just one disease you're dealing with; it's multiple, diseases. It takes time. It takes time to kind of find out all that information. But unless you get the proper information in, garbage in, garbage out is kind of an important part here.
all right. So I noticed that the news release also talks about creating new products. What do you foresee that looking like?
Well, that's exciting thing. I mean, again, with these partnerships, what I like is the fact that they see the value of our technology, not only in how they can apply it now, but also how it can be revolutionary in their own industry for products that have never existed before. Again, remember I told you before, Penny, that our technology could be used 1,000 different ways or infinite different ways. And we're not going to be a small company trying to go after 1,000 or 2,000 different spaces. And so partnering with companies like this to create new products that their industry has never seen before is the exciting thing. And that's what we're looking at here, is we're going to be working with them to create new solutions that they can use to their own clients, but also new clients going forward that the industry has never seen before, whether it's the employer, enterprise, insurance industry. We're going to be working together, figuring out where the problems are, and then figuring out how to apply our technology and their technology in a way that their space has never seen before. And that's exciting.
Well, I'm really excited to see how this enterprise partnership plays out, especially with, this many members. It's a really, it looks like it's going to be mutually beneficial. So I'm excited, especially as a shareholder, to see what this brings.
Yeah, no, thank you very much. We are excited as well, and it's just proving again that it's one step towards what we were talking about before, but it's proving again the value of our kind of a proprietary technology.
All right, perfect. Well, thank you for filling us in, and I can't wait to see you for the next news.
Okay, thank you.
All right.